All right, everybody, welcome. Today I have Dr. Amy Comander on, and Dr. Amy Comander is, want me to call you Dr. Amy? Or
You're welcome to call me Amy.
I'll call you Amy, but it's Dr. Amy Comander. For everybody who's going to go find her on Instagram and follow her, Dr. Amy Comander is a breast oncologist at Massachusetts General Hospital Cancer Center. She has a long list of things, and I asked her how I should introduce her, but I'm just going to tell you she's a breast oncologist, and she also has a lifestyle medicine program for what you do. So we're going to go ahead and just dive right in. So Amy, thank you so much for coming on today.
Thank you so much for inviting me. Excited to be here.
Yay. So obviously it is October, Breast Cancer Awareness Month. And I think as we spoke just briefly before this, that is something I think everybody should be interested in, men and women alike. And we should have a general understanding of what it is, and risk factors and things that we can do about it. So tell me what you do as a breast oncologist and how the lifestyle medicine, it helps your breast oncology.
Thank you for highlighting this very important issue. As you noted, it is Breast Cancer Awareness Month. I like to refer to it as Breast Cancer Action Month. What are steps we can take to provide education to women and men about risk factors for breast cancer when it comes to screening, risk reduction, signs and symptoms, etc. And so I'm so glad that we're highlighting this. And this is action right here, just talking about it. So that's great. So as a breast oncologist at the Mass General Cancer Center, I care for women of all stages who are diagnosed with breast cancer. And that would mean from early stage disease to individuals with recurrent or advanced disease. I also care for some women who perhaps have a increased risk for breast cancer since they may have a BRCA1 or 2 mutation or other genetic mutations or strong family history. So I kind of take care of patients of all of these different aspects along their journey. And as you noted, I'm also really interested in survivorship care. And that's where the lifestyle medicine piece comes in.
Yeah. Very cool. Very good. I love all of it. And I love that you said it's action, right?
Yeah.
It's not just awareness. It is action. 100%. I agree. Because obviously you and I both are kind of on the, what can we do now in prevention when we can't always prevent everything. So, I think that's important to note too. We always like to make sure we take the guilt off of everybody. But we like to give a lot of information. Okay. So you talked about, so everybody I think has been affected by breast cancer in some way, whether it was themselves or a family member. I can't think of anybody that I know that hasn't been affected. So let's dig right into kind of some of the things. Who should be tested? First of all, what age should we be tested as women? So let's start there. And what kind of test should we be doing?
What kind of what? Forgive me?
Testing should we be doing?
Question. Great place to start. So just for everyone to know, if your listeners are in the United States, after skin cancers, breast cancer is the most common cancer diagnosed in women. So that's important to note. And if we think about an average woman walking down the street here, I'm outside Boston, but wherever your listeners may be located, we all have a 1 in 8 lifetime risk of breast cancer. So, I think that's important for all of us to recognize. And you already touched on the fact that we all know someone, unfortunately, who has been touched by breast cancer, whether it's a friend, family member, teacher, member of the community, whoever that may be. You ask a great question. Screening is key. And when should women be screened? And sometimes this can be very confusing, I think, because interestingly, in our world of medicine, there's all these great organizations, American Cancer Society, U.S. Preventative Services Task Force. I can go on and on. I don't need to bore you. There's lots of different organizations, and some of them have different recommendations as to when a woman should start screening. I'm just going to keep it simple and say all women should start screening at age 40, okay? And actually, there is an updated recommendation from a big entity, U.S. Preventative Services Task Force, which highlighted that many months ago. There's a but there. If a woman has a strong family history of breast cancer, or perhaps has an inherited mutation that increases her risk, and we can talk a little bit more about that then she may need to start screening before age 40. And that is a conversation that a woman should have with her gynecologist or primary care physician, probably starting in her 20s, to figure out, when should I start screening?
Yeah. Yeah. And what kind of screening are we looking at?
Great. Yes. So, for a woman at average risk, I'll use that term, who maybe does not have a strong family history, who I'm saying starting at age 40, that would be a mammogram. So, your local hospital, or there's many screening facilities, just a mammogram. And we do have additional tools, and many of your listeners probably have heard of breast MRIs and ultrasound. Those tools, and those are often used as an adjunct to screening. But our most important screening tool is the mammogram.
Okay. And now I've heard a lot of times people don't want to get mammograms because they think it's like exposure to radiation or things like that. So, what do you say to somebody that is kind of fearful of that?
I would say that the mammogram is the most important screening tool for breast cancer, period. So since the early 1990s until now, the mortality rate, that means dying from breast cancer in this country, has gone down significantly, up to 40%. And why is that? Better screening because of mammograms, and of course, better treatment options. But the screening is key. We want to pick up a breast cancer when it's tiny, early stage, when it can be treated effectively with surgery, maybe, possibly radiation and other treatments, and highly curable. That is the goal. That is my job. I want to treat early stage breast cancer. And the reason we have excellent outcomes in this country is because of early detection with mammograms. So your listeners should not be fearful of having an annual mammogram.
Yeah. Yeah. I love that. And I'm on board too. I think I had my first one in my 20s. My sister had stage 4 breast cancer in her 30s. She's a survivor of I think she's 15 years now or something.
I'm happy to hear that. She's doing
yeah. Yeah.
She's a survivor.
She is. She's amazing. So with that, so when you test somebody or screen somebody and you find it at that earliest stage, what's that first stage considered?
Great.
Stage
So
1.
we pick up a breast cancer early, which is the goal. We will then discuss with a patient what is the stage of her breast cancer. And that is determined by, I explain this to my patients. I'm like, in kindergarten, we learn the ABCs. When it comes to staging, there's the TNM system. I try to keep it as simple as possible. T stands for tumor, N stands for nodes, M stands for metastasis. So we look at the size of the tumor. Are the lymph nodes involved? Lymph nodes under the arm. That's where a breast cancer can go, often first. And then metastasis. Is there anything anywhere else in the body? So I walk my patient through the TNM system so she understands her stage. So if some of your listeners do have a diagnosis or a history of breast cancer, I would encourage them to make sure they understand their stage, because studies show that a lot of women out there actually don't know the stage of their breast cancer if they are asked that question. So that is a very fundamental thing that every woman should know if she does have a diagnosis of breast cancer. She also should know some very basic biologic features about her tumor. Is it sensitive to the female hormones estrogen and progesterone? The majority of breast cancers are, but not all of them. And does it overexpress a marker called HER2 or HER2? So these are very basic things that anyone who has breast cancer should know. And I just am emphasizing that because, interestingly, not everybody does.
No, they don't. And I think you just hear breast cancer and I think fear overcomes you. And it's almost like there's this cloud that in front of you, and you can't even, I think any diagnosis, I think that you receive from a doctor that isn't pleasant. I think you go in and you can't hear everything. So, often it's important to have a loved one with you so they can help you remember things and, pick up information that maybe you couldn't pay attention to, because you are kind of in this kind of almost tornado in your mind, because I know that I've had to go in a couple of times where they're like, just come back, because I have very dense breast tissue. And with this family history I have, I'm like, okay, just go back in, just go back in. And it's all been fine, but still you get in that little clouded mind. So it is important that you do pay attention to the stages, because I don't think I've ever heard it put like that. And I've heard that word and, these conversations a lot. So I think that's really important. I wanted to ask you about, you said some were more like from estrogen and progesterone. So what's the difference in that?
Thank you for
I
raising.
didn't know there was a difference.
Yeah, you raised such an important point in your previous statement. I think it's a really good take-home message that when we hear someone has breast cancer,
Mhm.
breast cancer is not one disease. There are many subtypes of breast cancer. And as we as breast oncologists and researchers get smarter and smarter due to all the great advances we've seen over the years, we are learning more and more about at the molecular level, the changes and the different types of breast cancer. So I think it's an important message that not all breast cancers are the same. And so that's just a good take home. So you also raise a key question or key point about dense breast tissue too.
Mhm.
I want to just state that, many states now have laws that women are informed if they have dense breast tissue at the time of their mammogram. Young women like me and you, I'm still counting myself as young. We do have a high, at least 60% of us have dense breast tissue. Just something to keep in mind, and that perhaps may influence the use of other screening modalities such as ultrasound and breast MRI. But getting back to your question just now, again, breast cancer is the most basic level. Some are sensitive to the female hormones, estrogen and progesterone. And that's just a biological factor that we test for. And that's why maybe you and some of your listeners are familiar with medicines like tamoxifen, aromatase inhibitors. What are those medications doing? They're helping treat women with breast cancer because they either block estrogen, lower estrogen levels, and those are an important component of treatment for women with hormonally sensitive breast cancers. Similarly, I mentioned this HER2, which is overexpressed in about 15% of breast cancers in the United States. And because of great advances in scientific research, we have drugs that target those type of breast cancers too. Some of your listeners are familiar with trastuzumab or Herceptin, pertuzumab or Perjeta. Not to get into the details, just the concept that we've made so many great advances in scientific research that we can target specific types of breast cancer with our treatments. And this is an evolving field and a reason that all of us women and men get breast cancer too, all of us should be hopeful and excited about the scientific advances that are improving outcome for individuals with breast cancer.
Yeah, absolutely. I love that, because you automatically think breast cancer and then you think the worst, of course, everybody does. And then you think it's only estrogen. And you only think it's for women. So I wanted to talk about that too. Can men get breast cancer, and what kind of is the percentage of that?
Right. So in women, breast cancer is obviously much more common. I think in the United States predicted for 2024, it's at least it's around 310,000 cases will be diagnosed of invasive breast cancer and something called ductal carcinoma in situ, also known as DCIS. So it's very prevalent in women, is what I'm trying to say. In men, the rate, in the United States, it's predicted probably around 3,000 cases. So 3,000 compared to 300,000. So it's obviously much less common in men, but I do think it's important for if your male listeners to know men can get breast cancer. So men don't get mammograms, but men should feel their chest wall. And if they ever note a nodule or something strange and, on their chest wall, they should get that evaluated. And I think that's a really important message. Men can get breast cancer too.
Yeah, because I never thought that a guy could get breast cancer until one of my friends, her husband at the time, they actually thought he had breast cancer. And we were like, what? And this was years ago. It happened to be cat scratch fever. So he had a kitten and it clawed him. And all these things started. There's like a bump, and then he got sick. And they were like, I don't know, I think you have breast cancer. And he went through and they were like, it's cat scratch fever. So I didn't even know. But at the same time, I didn't know that, men could even get breast cancer.
Yeah. So a lot of people don't know that. So I think it's an important point to highlight.
Yeah, for sure. Okay. And then what about I heard you talk about this recently, and this is a really big interest of mine, considering my strong family history of lots of cancer is the genetic testing. And, is I had somebody on the other day and we spoke about it a little bit. I haven't released his episode yet, but what is genetic testing? Should we get genetic testing, and what types kind of genetic testing is out there?
Great question. So important to highlight. So I think it's important for your listeners to know that of all the breast cancers in the United States, actually only 5 to 10% can be attributed to genes that we can test for directly in 2024. So
Okay.
it's really a small percentage, but that small percentage is still super important to focus on. I should state that about 10 to 15% of breast cancers may be due to familial factors like family history, and maybe we haven't figured out the gene or genes yet. So again, research is evolving, and I can tell you, even over the past few years, how we do genetic testing has changed so much. But for individuals who are listening and like you, strong family history, you want to think about, gee, should I get genetic testing? And I think if you're thinking about it because of family history, the answer is yeah, you should, because I'm all about, again, Breast Cancer Action Month. How can we take action to reduce our risk and optimize our health? So if an individual is worried that she might have a genetic risk factor for breast cancer, again, BRCA1 and BRCA2 are the most common genes, but there are many others now, PALB2, CHEK2. Again, I can go on and on. There's many of them that now are tested for in panels. So sometimes it's great to meet with a genetic counselor. If your primary care or gynecologist can refer you to a genetic counselor to sit down and talk about your family history in depth and then determine the right testing. But I recognize that not everyone has access to a genetic counselor. So there are these companies now, I can't give a specific recommendation about which ones, but I know a number of them are out there where you can, meet with someone through the company and consider doing the testing yourself. And then somebody will go over the results with you if something comes back positive. And so that's an area of active interest as well to me, because I think it's important to make this genetic testing more widely accessible. But I would tell your listeners, start with your primary care or gynecologist. That would be my recommendation in terms of figuring out how to do the testing.
And then do they test for like everything when they go in to do the genetic testing?
Such a great question. So in this brave new world we're in, we have all these panels that we can test for so many genes that perhaps are related to cancer risk. And as we test for more and more genes that could be related to cancer risk, we're learning that we don't really know as much about all of these genes as we'd like at this time, because the science is still evolving. So it's not uncommon to have genetic testing and find out you have something called a VUS. What does that mean? A variant of unknown significance. And it's exactly what that sounds like. You have a variant of unknown significance in X gene. And as a patient, you're like, great, what does that mean? So what it means in 2024 is it really is that. Unknown significance, do not make any medical decisions based on this finding. And often over time, if there's more information gathered about that gene, you should be informed by the genetic counselor or whoever sent the test. But that can cause a lot of anxiety, I think, for an individual.
Absolutely.
That's why I encourage people to be mindful and thoughtful about what type of testing you pursue. And that's why I'm a little skeptical of some of the companies out there, just because if you're like, more is better, I'll get 100 genes tested, you will probably get a VUS, and then you're going to be like, So I would say it's important. That's why I suggest meeting with a genetic counselor if possible, to really have a more tailored approach to the testing.
Yeah, I can't agree more with that. I think that even on the kind of even the self-testing at home with all kinds of things, even outside of genetic testing, I come from the camp of, what are you going to do with that information? Who's going to interpret that information to you? And is it going to cause you more stress having that information in front of you? So I guess talking with a genetic counselor would be the best bet, it sounds like, and to find what's the happy medium for you and what are the most important things to do. And then what can you do with that information?
Yeah, you stated that perfectly. With any test that you ever have done, why am I having this test?
Yeah.
What do I want to gain from this? What am I going to do with this information? So that's perfect.
Yeah. And I think that, like you said, in 2024, especially, and I always say this kind of tongue in cheek, like in the wellness space, sometimes it's not well because a lot of people have access to a lot of things that can be great potentially. But with that information, more often they don't know what to do with it. And it's almost either a waste of money or it's causing another level of anxiety and stress that probably can be more harmful than the actual testing. So I am 100% with that camp. So seek out a genetic counselor after you talk to your primary care or your gynecologist. I love that information because you always think I want to be well prepared, but I don't want to over stress myself, because you and I both know, and we'll kind of get into this too after one more question, is part of a healthy wellness plan in general is stress management. And if you have information that you have no idea what to do with, and it's just going to put some weight on your shoulders and just kind of get you discouraged, then it's probably not worth having. I think anyway.
Agree fully.
Yeah.
100%.
Yeah. And so let's talk about this really quickly. You know, all over, let's talk about menopause, perimenopause, and all of these things. It's a hot topic right now, as it should be. But like with anything else, there's some misinformation and maybe some cloudy information that nobody really knows what to do with. And so let's talk about HRT. And does somebody, a woman in perimenopause that are kind of thinking about getting on HRT, does that increase your risk for types of breast cancer?
Right. Such a great question and very timely, of course. And as I would like to state that, like, use of menopause hormonal therapy is certainly a tool in the toolkit. I've heard others say that. And I love the concept of tools in our toolkit. I'm all about use the various tools, and we'll talk all about that. So, we can talk, I'm sure you've had other episodes where you've discussed, the Women's Health Initiative, and that was the study that was launched to really study the potential role of hormone replacement therapy actually with regard to cardiovascular risk reduction. And of course, we don't have to get into all the details, but the study is, flawed in many ways, but, was stopped abruptly because there was the suggestion of an increased risk in breast cancer. And that's why, the study authors at that time, I remember where I was in my residency, okay? At Israel Deaconess Medical Center, which is a hospital affiliated with Harvard Medical School. So I was not at a stage of prescribing these medications anyway, but I remember being like, oh my goodness, press conference. It was like a big hubbub at that time in my medical training. And so as we now reflect on that time, which, by the way, it's very interesting as a doctor at my stage now to look back at that time and how it was handled in the press, et cetera, we are learning that the breast cancer risk was small. Okay, so I do want to highlight that. And I would just say, which I still say to any, my patients have breast cancer, so it's a different conversation, but to a woman who's contemplating this, I think it is a discussion between the woman and her physician about the risk benefit given her individual medical history, her concerns, her family history, et cetera. So I'm not opposed to it by any means, but I do think it should be an informed conversation between a patient and her doctor.
Yeah. Because there's going to be a little more risk. Yeah, there's going to be a little more risk for some people than not, is what you're saying. And then
so if a woman has a strong family history of breast cancer, like one of my dear friends has reached out to me, she has a very strong family history, and she is quite symptomatic as she's now in menopause, and she's really having a hard time deciding, should I take the HRT or not? And, I can provide her with all the information and latest research that suggests, that the risk is not huge. Okay. But it's really an individual decision. Is she comfortable? Because she is at increased risk for breast cancer given her family history. So I want her to make that decision. It's not really something I can tell her you're fine or you're not fine. It's really, none of us has a crystal ball. So it's a complicated decision for many people.
Yeah. And I'm sure that's probably hard on you as a physician, but also as a friend to many that are going through those things to not have a definite answer, because people just want to say, am I going to be okay? You're like, I don't know. You got to make the decision for yourself. And I'm sure that's probably hard for you too.
Yeah, I think in all of medicine, there's uncertainty. And so I think with any decision any of us make about our health,
Mhm.
there's risk and benefit for every decision. So I think that's why I love that the work you do. Let's empower people to have all the information and then they can make the best decision for them.
Absolutely. And I think it can change in every stage of your life too. And, in every phase and, decade. I like to live life in decades almost, and see what's right for you at that time. So I love that. So let's move in. That's a perfect segue to the next section of your lifestyle medicine, and kind of what you do. So can we kind of talk about that and how your lifestyle medicine program, is it a program? It's a
Yeah.
12-week long program. That what do you do with that and how does that help?
Great. Love to talk about this. And I
Mhm.
love the work you do too. It reads
Thank
together for sure.
you.
So, for your listeners who are like, what is she talking about? Lifestyle medicine, never heard of it.
Mhm. Mhm. Yeah.
So it is a branch of medicine. There is an organization that people could check out, American College of Lifestyle Medicine. And we really focus on, again, evidence-based tools for the role of lifestyle interventions to help optimize our health and reduce the risk of chronic disease, type
Mhm.
2 diabetes, hypertension, heart disease, dementia,
Yeah.
cancer. Okay. So these are all of us, no matter who you are, you want to help prevent those things, right? So what is
Yeah.
the evidence about our lifestyle that we can improve upon? And I know, Pam, this is a passion of yours as well. So when we think about lifestyle medicine, just to give a quick overview, there are 6 pillars. Okay. So we're going to go
Mhm.
through them real quick. And if you want to talk about them in greater detail, we can. And we can just start with the first one, which is probably your favorite and my favorite, although
Yeah.
I love them all. Physical
Yeah.
activity,
Yep.
so key. And we can talk about that in more detail. So
Mhm.
that's important. Diet. And when I say diet, that's like really our nutrition, our
Yes.
approach to eating, and really a focus on a whole foods, plant predominant diet. That's what I'm talking
Mhm.
about. You already
So
highlighted
general
those.
lifestyle, I'm sorry. So general lifestyle medicine, is taught with plant predominant
I
nutrition.
like to use the term plant predominant. I don't tell people you need to be a vegan or anything like that. I just say plant predominant. Half of your plate, fruits and veggies.
Yeah.
Where Harvard School of Public Health has this great plate on their website. It's called the Harvard Healthy Plate. And I
Mhm.
love it because it's so simple. Nutrition is all over the place. It's so confusing for everyone. Just
Yep.
look at this plate. It's a beautiful picture. Half of it is fruits and veggies, and then a
Yeah.
quarter is some type of whole grain, and a quarter is some type of protein. Keep it
Yeah.
simple, guys. Let's not go all crazy with all the diet stuff. And so that's why I like to focus on that. So,
I love it.
physical activity, nutrition. The third one you already mentioned, stress. What are some
Mhm.
strategies we can use to help address stress, reduce stress, which is very much associated with chronic disease? So, we can talk more about that.
Mhm.
A fourth one, avoidance of use of risky substances. We can talk about that in
Mm.
great detail and
Mhm.
why that's not good for us. The
Yeah.
importance of restorative sleep. That's something I'm always working on. I welcome
Me
tips on
too.
that.
Yes.
And then the final one is social connection and the importance of support in our community from our friends, family, loved ones. And actually, this is such a big one that in some ways I'm learning maybe actually the most important one, maybe even more
Mhm.
important than exercise. So anyway, those are the 6 pillars. So I will stop talking so we can talk
Yeah.
about what you'd like to go somewhere.
No, I love it. I love it so much. So you know that in my cardiac rehab, intensive cardiac rehab, we are also lifestyle medicine, and we cover those pillars as well. And I like to bring that to my online clients in my personal training groups online, and I often talk about the community portion. And I love that you brought that up. So you guys, I'm not just making stuff up; it's
There's
true.
good data to support it.
There's data to support it. And I am a firm believer. So I've been in this space my entire adult life. And I think a lot of different plans can work, whether, whatever it is, whatever you choose to do. But none of them will stick if you don't have the proper community behind you. And I see it in my cardiac rehab and I see it in my own online programs. And that's why I like my online program for fitness is, of course we have the nutrition and the exercise and all of those things are great and obviously very important to learn and educate. But the biggest portion for sustainability is the community that we have built and the accountability of, like you have mentioned before, like-minded people. And I see that in cardiac rehab when they all form these bonds and these friendships over 12 weeks. And then when they're gone and graduated, they remain friends, we hope, and for that community portion of it, because I think we've all, and this was really good tie-in for both of us, because I think we're both really on a parallel mission. And that's really what drew me to you. I spoke to her before we got on, and she was one of the people on Instagram said, you might like to know. And I'm like, I sure would like to know her. And I think it's very parallel as an exercise, and we love to do what we do, but we also love to pull that community in as well and make it very realistic and sustainable. So the community aspect, I love that you said that, because I talk about it all the time. So I hear that that's kind of your favorite part of it as well, I think, is the community.
So I love what you do, and I love that you highlight that. And anyone who's part of your community, you all should know you are so fortunate, because that is so important for sustainable change in our behavior. We can read all the books we want about exercise and nutrition, and trust me, I have a million of them. But if I am not part of a community of people supporting me, even me as a doctor, I'm not going to be successful. So I love that you highlight that and promote that with your own, the people you work with. That's great.
Yeah. And you do that in your cancer, is it survivorship?
Yeah. So I will admit to you, Pam, like, I'm sure you figured that out early on. Community is key. But for me, when I first started this program for breast cancer survivors and thrivers, as they like to call themselves, it's a 12-week program, Paving the Path to Wellness, which is, by the way, an amazing collaboration with colleagues Dr. Beth Frates, Dr. Michelle Tollefson, Val Tivnan. We started this actually for breast cancer 5 years ago, which is hard for me to wrap my head around. But anyway, 12 weeks focused on lifestyle medicine pillars that we just discussed. Plus we throw in other topics, goal setting, the importance of timeouts, sense of purpose. It's a really great program. And when the last session ended, the first time I offered this in 2019, I was like, you did it. You provided the education. You did it. They're done. Great job, Amy. I was like, because I was nervous doing it. And then the women were like, hello, we're not done. They were all bonded. They connected with each other. They were supporting each other each step of the way. And they wanted to continue to do that. And they're like, this group is successful because of those bonds. And those ladies are still very bonded to each other and helping each other thrive after breast cancer. Okay. And so that community and connection piece, I then realized, like, that was the greatest gift of the program. Not all the slides I shared about nutrition and exercise and stress and blah, blah, blah. It was the community. So I think we're on the same page about that.
Yeah. And what do they say? Like, you can tell, the people won't remember what you said, but they'll remember how they felt.
Yeah.
And that's definitely probably in line with all of it. They remember how they feel going through the program with, with all that. And I think at 12 weeks, so my cardiac rehab is 12 weeks as well. And then they graduate, and I don't have a graduation program, but I always tell them, like, I'm preparing you with things that you have to do at some capacity for the rest of your life. And I'm always hoping, like you said, that they form that bond with each other, because it's almost like I have to take my little cubs and just let them go in the free, in the wild. and that's kind of how that is. So community, very important. Stress management, sleep. You said you suffer with sleep. I do too. And it's only because I honestly just have so much to do. And I could not, I would give up sleep for forever if I could. Obviously I can't, but I like to remind my clients and patients that we all suck at something we should be good at. And I really am not that great at sleeping, and I'm going to always work on it. So let's hear, what are your recommendations for sleep? What are the hours people should be getting? Go for that.
The irony of this topic as well for me is that I am collaborating with a wonderful colleague at MGH. His name is Dr. Daniel Hall, on a study to address insomnia in cancer survivors. So I'm a co-investigator on a sleep study, and I'm acknowledging that I need to work on my own sleep. So it's just kind of funny. But anyway, I'm sure you talk about the same things in terms of, like, this term sleep hygiene, which is such a funny term, but, like, just the basic things about trying to go to bed at the same time each night, trying to get up at the same time in the morning, keeping the room dark, keeping the bed just for sleep and sex, not for scrolling on Instagram before you go to bed, not for reading social media, not for watching the news, not even for reading. The bed should be for sleep and sex only. So you're supposed to teach your body that. And that's something we all need to work on. And, keeping the room cool at night, that's a recommendation. Avoiding caffeine after 2 p.m. I've been doing that lately, and that is helping.
Yep.
And so those are some basic strategies, but my colleague, Dr. Hall, has taught me a lot about strategies as well from cognitive behavioral therapy, which is really the mainstay of treatment for insomnia. And that's a hard one. It's like, if you're in bed and you really can't sleep, even if it's 2 a.m, you're supposed to get out of bed and go to another part of the house and like chill out for a little bit so you get tired, and then go back to bed to kind of train your body only to use the bed for sleep. And so we teach people that, and I guess I should teach myself. So it's a work in progress.
Yeah. And it's not anything. So I think I had a little bit, and I've got some really good sleep hygiene I've had to practice myself. And like you said, we kind of teach similar things. In fact, I just wrote for Dr. Bill Campbell for his little newsletter about sleep deprivation and what I teach. But it is so important to note all the time, and we can never say it enough, that I think sleep and fiber actually is a couple very unsung heroes in overall health and fitness. Those are 2 key things. And I even tell my patients, some of them come in because I think we don't emphasize sleep. I mean, now we do, and in this space we do, on the internet. But a lot of people, I'm sure that you're working with, and I do too, they're not online and they're not really hearing new information. And they may have grown up on, a farm, or they just, people work early and they just don't really think about sleep. They just get up and they have 4 hours of sleep and they don't really think about it. So one of the first things I do as well is I'm like, how much are you sleeping? They're like 3 or 4 hours. I'm like, oh gosh, well, that's the first non-scale victory we're going to look at. We're going to work on your sleep.
So
very important.
I got this little thing. I don't know if you have one. I got an Aura ring. Oh, look at us. I am not advertising for Aura ring. I'm just stating that I'm deeply committed to working on this for myself. And I got this little thing to help me with my sleep. And if you ask my husband, he'd be like, so what does it show? And I'm like, it's not really helping it. But again, we are all a work in progress.
I actually, I got this too. And it's funny because I don't really care about a lot. I like to track my steps. It's fun to see, but I don't really care about a lot of that stuff. But I got it strictly to keep me accountable for sleep, because I don't like to get a bad grade. And I like to see, I'm sure you're the same way too. My friends and I have this too. And we're like, what was your sleep score? And we'll like look at see when we're awake. And I'm like, oh, my readiness is great. My HRV is, so it's a really fun accountability thing. We're not sponsored by the ring or anything like that. And I'm not telling you to go get one.
Looking mine up and you're gonna laugh. I think I need to charge mine.
Yeah. I think we're very kindred spirits when it comes to that kind of stuff. And then nutrition, you said very, very plant predominant, and I think that every again, fiber, and I think that every health and wellness and fitness even should kind of be plant predominant, and that doesn't mean no meat, like you said. We're not eliminating meat. So let's talk about, before we run out of time, we talked about HRT. I want to talk about, we'll talk about this one real quick. So this was your number 4 on your list. And this was refraining from, was it harmful substances or what? How'd you?
Like alcohol,
risky.
tobacco use, etc.
Yeah, I love that. And that's not anything that we've ever put in a pillar. And I love that you put that there because I think it's overlooked too, because in a world where nutrition shouldn't be confusing, it's confusing. And everybody tries to, have the right answer. And it's not that hard. But then what about the alcohol? And we all know smoking. I mean, most people know smoking's not good for you. And if you don't, then smoking's not good for you. But alcohol, it's such a funny subject. So what's bad about alcohol, I guess, in relation to health and cancer?
Yeah, great question. So a reputable organization, the American Association of Cancer Research, AACR. Again, if I mention a website, it's because it's evidence-based and I recommend it. So
Absolutely.
AACR, major organization, came out with a cancer progress report, I think it was like in September actually. And they did really highlight what we call modifiable cancer risk factors. And what does that mean? A risk factor that we have control of, like you and I can control. And that's some things like Do we smoke or not? Do we exercise or not? Do we drink alcohol? Okay. So alcohol is actually the third most common, I guess, in terms of modifiable risk factors. Smoking's number one. Like, please don't smoke.
Right. We all know by now.
Really good strides in getting back on that in this country.
Mhm.
Thank goodness. The second one is excess body weight. And hey, we know this is a challenge in this country. Thankfully, due to the work that you're doing and so many others, we're hoping to address this major public health issue, because it is a cancer risk factor as well, by the way, excessive body weight. And number three is alcohol. So, and actually they cited in this report, 51% of Americans do not know that alcohol is a cancer risk factor.
They don't.
So
No, they
not.
don't.
The fact that we're talking about this, again, Breast Cancer Action Month, we're taking action, we're raising awareness. So, so why does alcohol increase the risk of cancers? And this is obviously an area of research to understand that alcohol actually, is a carcinogen. It can cause direct DNA damage through its metabolites. And when it comes to breast cancer risk, if we want to focus on that, alcohol can potentially raise levels of estrogen, which is a risk factor, and cause inflammation, et cetera. So there are many potential hypotheses for how alcohol can increase risk of breast cancer and other cancers that were listed in this report: stomach cancer, esophageal cancer, et cetera. So I would encourage your listeners to look up this AACR Cancer Progress Report. There's some great figures that anyone can understand on their website, which really highlight what are things that we can change to help reduce our risk for breast cancer and other cancers.
Yeah. I love that. I've never had that problem. I've never been a fan of alcohol. I've never had it as part of my life. And that's not saying I'm better or worse than anybody. It's just not ever been an issue. I've had all kinds of issues, but alcohol has never been one. So when people come to me with, what do you think is a healthy drink? And I'm like, water, and so I don't ever have the answers for that, because that's not my area of expertise. I don't have experience with it, and I just prefer not to drink. But what if if they want to reduce their alcohol intake, if somebody came to you as a physician and they're like, I really just, I'm going through all of this. I just really love my glass of wine every night. How harmful is that?
I'm actually looking up. So I will say, I'm not telling people like completely eliminate alcohol altogether.
I mean, you can say they can completely eliminate it. That's okay, because let's say good, better, best. So
right. So there are, obviously, I will say that for women, I hate to say it, but that is ideal. But I also like another website I will give a shout out to, AICR, American Institute of Cancer Research. Lots of great evidence-based information about, again, lifestyle strategies to reduce cancer risk. And when it comes to alcohol, I love the quote that they have: think before you drink. So it's sort of like scrolling on social media. Why are you doing it? Are you trying to just kill some time? But think before you drink. So let's say you're going out to celebrate someone's retirement and everyone's having a glass of wine at a nice Italian restaurant, and you want to celebrate. Okay, have the glass of red wine. I will do that too, by the way. I do love a glass of red wine once in a while. So just be mindful. But if you're kind of coming home from work every day, cooking dinner and having one or two glasses of wine, why are you doing that? That's not a good habit. So I just think people need to be mindful of their behaviors. But I want to give a shout out to a colleague I recently met at a conference who has a really fun Instagram page where she often highlights mocktails. So when you're saying, what can I recommend to my patients or clients who are like, what do I drink instead if I'm going out to a party, hosting a party? And her Instagram is Cancer Nutrition HQ. Her name is Christy Zungia, PhD. She's also a registered dietitian. Maybe you should invite her on.
I do follow her.
Videos where she shows a mocktail, and she provides really great nutrition information as she's making the mocktail. So I love watching her, and I'm always like, I would make that. That looks so good. I'm not always good at following through, but I would love to give her a shout out because she has all these fun, creative ideas. Another creative idea, shout out, a wonderful oncology registered dietitian I work with. Her name is Carol Sullivan. She often talks about the health benefits of tart cherry juice. I'm not sure if you've ever had it, but okay, tart cherry juice. And it's very deep red, beautiful color. I love that color. She'll put it in a wine glass and she'll say, substitute your red wine with some tart cherry juice, which has so many benefits health benefits, particularly for joint pains that many of my patients experience, and other benefits for sleep. And so that is another tip and trick. So those are just a few ideas out there.
Yeah, no, I love that. And have, like you said, I like the think before you drink. And I actually do follow Cancer Nutrition HQ. I love her page.
She's awesome. I've met her in person.
I should have her on. She would be great to talk about that kind of stuff. And then also think before you drink, because yes, ideally you'd say, yeah, don't have any, but you don't want to take somebody's complete joy away. And you never want to, I always make sure that everybody knows that they should be fitting fitness and health into their life and not their life around their fitness, and not to dread what they're eating, and just learn to love new foods, and not to say, I can't have that. Say, I choose not to have that all the time, but I'm going to have it at this special occasion. And that's okay. Because it's the consistency, right? And the overall of what you do, what matters the most.
Agree. Yeah, definitely.
I wanted to talk about one more thing too. So, can we turn on and off our genes by what we're doing in our lifestyle?
Right. So that's a really fascinating question. The role of epigenetics. Can we change our gene expression by certain lifestyle behaviors? And, certainly we can talk about one of our favorites, exercise. I mean, as a cancer specialist, there's actually a whole field called exercise oncology. I joke that if I'd known about this when I was younger, I'd say, I'm going to be an exercise oncologist when I grow up. But anyway, there are scientists trying to study what is happening, for example, in the muscle of a person and the tumor of a person when they're exercising. And obviously, a lot of these studies are really done in animal models where you can dissect out the tumor or the muscle and look at changes in gene expression after exercise, or looking at changes in the immune cells, or something called myokines, which are chemicals secreted by the muscle during exercise that could potentially have biologic activity when it comes to the tumor. So this is a really cool area. I'm just talking about exercise, but yes, our gene expression is always changing. That's how we function as living beings. And I think it's fascinating. So I think this is an area that we're going to continue to learn more and more about.
Yeah. And so with the role of exercise, of course, that's my favorite, right? And I'm sure you're probably under the same recommendations of 150 minutes a week, or 75 minutes of vigorous as your baseline. Are you on the same? That's probably, And then, what about somebody who's going through treatment, cancer treatment, or maybe post, like for my sister, for example, should she be doing less exercise, more exercise? And let's say somebody's going through treatment. Is that something that you include in their treatment, like protocol, is exercise?
Great question. And we need people like you to help us implement it. So the American Society of Clinical Oncology, my big organization, came out with a guideline 2 years ago focused on exercise and diet recommendations for individuals with cancer going through treatment. And guess what the number one recommendation was? Evidence-based. Again, you can Google this.
Yeah.
Patients with cancer going through active treatment should be encouraged by their oncology team to exercise. It is there in black and white. Breast cancer, colon cancer, sarcoma, whatever you have, yes, you should exercise. And when we say exercise, we recognize that every person is starting at a different place. People might not be feeling great. We might be talking about walking to your mailbox, walking around your dining room, walking up and down your stairs, whatever that may be. But guess what, Pam? We, as an oncology field, are not doing a good job with that very basic recommendation. So we need to collaborate with people like you in this field who can really help us get our patients moving. So important for so many reasons. So absolutely, yes. And 150 minutes of moderate aerobic activity each week, that is recommended for individuals with cancer as well by organizations, American Cancer Society, American College of Sports Medicine. So it's very applicable to our patients as well.
Yeah. No, I love that. I love that you, as a physician, you're like, we need people like you. Cause always my dream was to work with physicians. And I have that, in cardiac rehab and ICR. It was just such a blessing and such a dream to be offered to be the director of a facility like that. And just to merge kind of the physicians, because there's a lot of doctors that like you, like, they just don't have the time. Like if you had the time with every patient to exercise them and to do all the things you could, but everybody needs to have their own team.
Oh,
And
sure. And by the way, we don't even know. I mean, many of us don't even know how to like counsel a person on exercise or how to get them started. So we absolutely need the team. So 100%.
Yeah. So exercise, nutrition, fiber. What's your fiber goal? What's your fiber recommendation?
No, so we are so deficient in fiber, right?
I think it's the hidden macro. It's the hidden most important macro next to protein. That everybody talks about protein, but I think there needs to be more talk about fiber.
For sure. And so, in fact, we just led a cooking class for our paving program just the other night. And we were talking about fiber and at least 30 grams a day for women. I'm curious if that's what you recommend. But, that's what
25 to 30.
Like, yeah. What did you say? Sorry?
25 to 30.
Yeah. So AICR, again, American Institute of Cancer Research, and other organizations do highlight that. Like, why do we need fiber? Think about your gut microbiome, another area that we're having so much exciting research, but there's like to make our gut microbiome happy and healthy and diverse and able to help us in terms of thinking about chronic disease risk, et cetera. Like we need the fiber. The fiber is so important and we are so deficient. And women in particular, we get like, I think the average woman gets like less than 15 grams a day of fiber in the US. And we have a lot to work on.
Yes, we do. We do. So yes, I want to make sure that we don't lose everybody. Like I said, I could go on for hours. It was such a joy talking to you, and to learn all of these things. And there's a lot more I could ask, but I want you guys to go ahead and follow her on Instagram. Do you have a website or anything like that?
Great question. Maybe that's a 2025 goal.
Yeah,
I'm all about SMART goals. But I right now have an Instagram that I am trying to be more active on. So it is fun, and I love following yours too.
Thank you. Yeah, and I know it's really hard. I mean, even as a fitness professional doing online fitness as, almost a full-time job, it's still challenging to get on there and post all the time and, make it relevant and, all those things. So we do appreciate you. She's like this little hidden gem on Instagram, you guys. And so do you want to leave us, all the ladies, with any of the last kind of words of advice, maybe some hope, maybe some tips? What would be your last thing you want to leave us with?
Right. Well, I think all of this can be very overwhelming to many people. Like when you're trying to be like, oh my God, those 6 pillars, I'm going to work on all of them at once and make all these changes and be the healthiest version of me. And I think it's really helpful. And people have told me this too. Pick one thing you want to work on. Just start with one thing. Maybe it's something like we talked about, improving your sleep, trying to go to bed at the same time each night. Maybe it's, I'm going to have half of my plate be fruits and veggies for at least 3 dinners a week. Start with something small like that. So I think it's really overwhelming for a lot of us. So just pick one thing that you want to change and try to do it this week. And maybe let Pam know what that one thing is going to be, and she'll help support you and have a community support you. Let's get back to that. Tell someone that you're doing it and tell them, I'm going to do this and I will report back to you in 1 week, because that is so key, the accountability support community.
Yes. Well, I love it. Thank you so much, Amy, Dr. Amy, for coming on and spending some time with us. You guys go give her a follow, and we will be on the lookout for your website and anything else that you're doing. I know that you are very busy, but keep up the amazing work, truly, wholeheartedly. So grateful. And we're so thankful for you.
Thank you so much.
Mm-hmm.